So today I'm going to be performing an osteopathic integrated exam for chronic back pain. Here we have a patient who is a 58-year-old male who has a history of cardiac disease and presents with chronic back pain for the past 2 months. So in order to start, I'm going to be doing some diagnosing, seeing how your spine and your head and neck region move. And after I do some diagnosing of your structure and posture, I'm going to go ahead and see what's going on, and then I'm going to treat. Is that okay with you?
Yes, please.
Okay. So first, I'm going to have you lay down with your head facing that way. I'm going to be diagnosing the OA first, and I'll be taking notes of all my diagnoses on a piece of paper. You can move up, that's fine. Thank you. Just relax your head. Okay, you can sit up again, and you can have a seat right over here. So his OA was rotated right and side bent left. Now we move on to his thoracic spine and then his lumbar spine. Feeling the paraspinal muscles for any tenderness. Let me know if you're any tender in this region. Are you tender?
Yes, well, yes.
Just a little bit?
Yes.
Can I have you extend your back? Very good. And can I have you flex forward now? Okay, so it gets better with extension and worse with flexion. And it's at about the, right about the T6 region. Okay. You can come down more. This feels okay. About even on both sides. Making my way down to the lumbar spine. Is this a little bit more tender over here?
Yes, a little bit tender. Yeah.
Okay. Now can I have you lean forward again? Still not any better. Can I have you extend backwards? Okay, it does get a little bit better with the extension there as well. So just take a quick note of those findings. So his thoracic spine at about T6 is extended, rotated left, and side bent left. And at L3, he's rotated right, side bent right, and extended. Last, I'm going to go ahead and diagnose his sacrum. So if I can have you stand up, please. I'm going to go ahead and feel for his PSIS. Okay. Now you can flex forward for me very slowly. Flex forward, bend over, bend. Good, 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 good. Keep going, good. Come back. So noted that his standing flexion test was positive on the left. And I'm gonna have you lay down on your stomach. That's fine. Feeling his PSIS again. I'm noticing that his left one is significantly superior than the right. And now can you turn over for me? Lay down on your back. Very good. Now you can lift your legs down. I'm gonna check his ACEs. So his left ACEs is definitely a little bit more inferior than the right. You can sit up, please. This means he has a left anterior innominate sacrum. Now, which part of your back was bothering you most? The upper back?
Yes.
Okay, so around the T6 region, the patient notes that it was bothering the most. So I'm going to go ahead and treat the thoracic spine with HVLA. So, HVLA is a passive and direct technique. I'm going to be placing my hand under you and doing a quick thrust and trying to release the joint that's stuck over here, okay?
Okay.
Okay, so if I can have you put your head up this way, lay on your back. On your back. Just like this. this way. Okay, breathe in. Breathe in. And breathe out. Breathe in. And breathe out. So, got a nice little crack there, just around the T6 region. So you definitely needed some treatment. So, how does that feel? Does it feel any better now?
I don't know. Give me a sec.
Can you slide over this way? Does it feel any better?
Yeah.
It feels a little bit more looser, but maybe we can address that more moving forward in the next week or
Next
so.
one. Yeah.
Okay?
Okay.
So now we're going to go ahead and treat your anterior innominate of your sacrum. If I can just have you lay down over here. I'm going to treat this with muscle energy. Here, move up this way, move up. So your head is on this chair. So for the left anterior innominate, I'm going to take your leg, use some muscle energy. I'm going to stretch you out a little bit, okay? I'm going to take. Don't fight me, it's okay. I'm going to bend you. See, very restricted in this motion. So I'm going to hold this for 3 to 5 seconds. Just breathe. Okay. Then I'm going to take it up a little bit more. Can you just push against me with about 15% of your resistance? Good. 3, 2, 1. Relax. I'm going to take it a little bit more and use your resistance again. Relax. Take it up a little bit more. For the last time. Use your resistance. Okay. Okay. So, did that to treat his anterior innominate. He's very restricted. He used some resistance to help me out there. And let me just check and see. We're trying to push the ACEs up a little bit, and it does look like it's a little bit more even, but we can also address that in the time coming. So if you can sit up for me, and sit over here, facing the camera. So today we address your thoracic spine with some treatment and your innominates. So we used some HVLA for your thoracic spine, got a nice crack there to release that joint space, and then for your innominate we tried to push it a little bit more posterior because it was anterior. So using the ABC models for autonomics, since you do have a history of some heart disease, the organs in your chest region can be transmitting some pain back to over here in your upper spine and in your back. So that's something to keep in mind. We did address the vagus nerve when I was going ahead and treating and diagnosing the OA. So that's for that. As for biomechanical, his posture is a little bit off. I mean, his anterior innominate could definitely be transmitting also some pain up because of his biomechanics up to his spine. So since we treated the anterior innominate, that means we could also help his spine move a little bit easier as well. As for circulation, I'm not noticing any edema or lymphatic issues, but if we wanted to go ahead and treat the thoracic inlet before to improve some lymphatic drainage, that could work as well. And for screening, we did use the zinc pattern. Like I said, the OA was rotated right, and then his thoracic spine was rotated left, his lumbar was rotated right. So that follows the zinc compensatory pattern, and it's pretty equivalent there. So we can also just treat his structural issues moving forward and try to get that mobility better. Do you have any questions for today?
No, not really. Thank you.
All right, thank you so much.